Tá, já comecei aqui.
Obrigado, Márcio. All right. Good afternoon, everybody. I have here a presentation today. Thanks to all of you that joined us today in another installment of the Immuno webinars, which is a joint endeavor of the Biophysics Institute at the Federal University of Rio de Janeiro and the Biomedical Science Institute at the University of São Paulo. Today, we have the honor and privilege to host Dr. Patrícia Machado Rodrigues e Silva Martins, who is a senior researcher at the Oswaldo Cruz Institute. Patrícia graduated and obtained her master's in biology from the State University of Rio de Janeiro and got her PhD from the Oswaldo Cruz Foundation under the supervision of Dr. Boris Vargafti. Pharmacologist by training, Patrícia made important contributions on the pharmacology of the inflammatory processes triggered by different pathological conditions that resulted in 188 papers and almost 3,200 citations. One of her main interests is the identification of novel therapeutic targets in pulmonary silicosis, where she studied the roles and potential application of glucocorticoids, A2A receptor, toll-like receptors, Nexin A1, IL-13, and more recently, IL-33 in these highly debilitating diseases. Patrícia also supervised 31 masters and 19 PhD students, and I have the honor to be her first PhD student. I always tell her that every time that I present her, I remember her that, so she cannot escape these. I was her first PhD student. And but now, on behalf of Professors Cristiane Bandeira de Mello and Miriam Werneck, and also our colleagues at USP, Professors Gustavo Amarante Mendes and Diego Costa, I thank Patrícia for accepting the invitation to speak here today and cede the floor to our guest. Patrícia, please.
Falo normalmente? Falo.
Aperta o botão do pointer,
E
com ele apertado, ele tem um certo leve, aí você consegue andar com ele.
Tá certo.
Tá? O slide passa aqui, para frente.
Se eu fizer bobagem,
tá? E se você ficar mexendo sem estar apertando o pointer, ele não anda.
Tem que apertar o pointer.
Tem que apertar o pointer, ele dá um levezinho.
Falo dali.
Você fala aqui, porque aí você fica pegando aqui.
Tá me vendo aqui?
Ou você pode falar lá do lado, ou quando você ficar.
Talvez aqui seja melhor.
Bruno, ainda não está compartilhando conosco, não, hein?
Não entendi.
Não está compartilhando a tela dela conosco.
Tá.
Daqui não dá, né? Tem que ser para cá, então. Vamos lá. Aqui fica. Você tá me. Como é que vocês sabem que eu estou. Claro, eu tô ali, né? Agora que eu. Desculpa.
Não, ele vai te
Tá.
Show, agora tá.
Se ficar daqui, ele me vê, então?
Beleza, excelente. Então, você fica
Posso ficar aqui?
à vontade, a câmera.
Porque ali do
vai
lado
atrás
fica
de você.
muito próximo,
Tá.
sem chance de apresentar. Peraí, sumiu o mouse, o pointer. Eu tenho que aprender a controlar o mouse, né? Esse é o problema. So, good morning or good afternoon. Firstly, I should like to thank the organizers of this, the Immuno webinar. I know this is organized by the Carlos Chagas Filho Biophysics Institute, together with the ICB from USP, two quite renowned institutions. And I'm very honored to be here to participate in this symposium, in this, let's say, seminar. And because I have two main reasons, at last two main reasons to do that. First, because I am a researcher of Oswaldo Cruz Foundation, which is part of the Fiocruz. And early in the 20th century, Carlos Chagas was a doctor, a scientist, a researcher, and he described the genus Plasmodium as the causative of malaria, and also he described Trypanosoma cruzi as causing Chagas disease. And his son, Carlos Chagas Filho, also a doctor, also a prominent scientist, he created the Institute of Biophysics in the University of Brazil. You know, nowadays it's Federal University of Rio de Janeiro. So there is still a significant connection between these two institutes, Oswaldo Cruz and biophysics. And I think that perhaps we could work in order to, let's say, to strengthen these connections, let's say, going a step further. And the second reason, no less important than the first, is because the person, the researcher who invited me to the seminar, no, wait. No problem. Just a second. Yeah. So the person who invited me to the seminar, Cristiane Bandeira de Mello, she spent some of the initial training in the Laboratory of Inflammation at Oswaldo Cruz Institute. And he already mentioned that, and I couldn't forget, I could never forget to mention him. Also, não tem como botar. Yeah. Bruno Lourenço Dias, you can recognize him here. He also spent some time in the many years, I think. He started when he was undergraduate student up to PhD. So it was really a pleasure, 9 years, 8 years. So it was really a pleasure to have him. And so this is the second reason. And at the time they were working in the Laboratory of Inflammation, we were in a building, the Osório de Almeida, which is in Manguinhos campus. So this is our lab. But after 33 years, they decided to change a little bit, a lot of investment of the foundation in a new building, and we moved to a new building. This happened a month ago, and this is now, we are in the Maré campus. This is a building that the first time that the foundation for the last years put a lot of money in the laboratory conditions, the infrastructure. And this building is dedicated to research, innovation, surveillance in COVID-19, and also other health emergencies. And this is our lab. You can see here that we are still unpacking, but we are quite optimistic that this will help a lot concerning the research conditions for us. This is just to show you here, because we are in the Fiocruz, the campus of Rio de Janeiro. So this is the main campus, the castle that you know. Here is here where we were, and now where we are, just across Avenida Brasil. So we are quite closer to the Federal University. And very briefly, just to let you know, this the Laboratory of Inflammation, it was created by Renato Cordeiro, who was a renowned scientist, biologist, and pharmacologist. So while he was an undergraduate student, he was supervised by Dr. Aichi Musashi in the Oswaldo Cruz Foundation at early times. But then Dr. Aichi was a physiologist. I'm having some problems with this pointer. It's my problem, I think. Anyway, so Dr. Haiti, he was a researcher at the Oswaldo Cruz Institute. É o jeito que eu estou apertando, eu acho.
Não, é que tem duas telas. Ele está correndo para outra tela.
Eu tenho que ficar mais aqui, então.
É só você não jogar ele todo para lá.
Ficar aqui, tá. So he was exiled in 1970 during the Brazilian military dictatorship. But then several years after, he was reinstated in the foundation. And by this way, we reorganized the Department of Physiology and Pharmacodynamics. And by this way, we created the Laboratory of Inflammation. Nowadays, this is the team of the laboratory. Since 1990, Marco Aurelio Martins, a pharmacologist, is the head of the laboratory. We are in 5 researchers, technologists, technicians. In fact, we are in 50 people now, including postdocs, post-graduation students, undergraduate students, and so on. And for the last years, we have been focusing on the study of the acute and chronic lung inflammatory diseases. And as pharmacologists, we have been trying to look for new targets, therapeutic targets, and new therapies for some of the diseases that are uncovered by effective treatments, such as the asthma, particularly the steroid-resistant asthma, COPD, emphysema, and also silicosis. Therefore, going to the lungs, we know that the lungs they have the control of gas exchange between the inspired air and the blood. And because of that, they are quite affected by different elements present in the environment, such as pathogens, virus, bacteria, mold, pollen, smoke, particles, odors. And at the end of the day, we have a wide range of pulmonary diseases that can be topographically classified in obstructive, in which you have a reduction in the airflow, more dependent on bronchoconstriction, as we have the case of the asthma and COPD. But we also have another group of diseases, which are the restricted ones, in which you have a reduction in the volume of the lungs. The lungs have difficulty to expand. And these are more or less more dependent on the occurrence of fibrosis, which is a response associated with thickening and hardening of the lung tissue. This makes it difficult for the gas exchange, and we have several consequences, including the shortness of breath. So we have some interstitial diseases as examples. Some are more acute or more chronic, but in the case of the chronic, we have the idiopathic pulmonary fibrosis and also pneumoconiosis. This last one here is a class of disease associated is an occupational disease, a group of occupational diseases, and they are associated with the overexposure to respirable dust containing particles. And so I will draw your attention to pneumoconiosis, and among them, I will focus on silicosis, which is the most prevalent of these diseases in the world nowadays. So silicosis is a fibrotic, as already mentioned, pulmonary disease that happens after inhalation of silica particles. And this is an irreversible disease and potentially fatal, particularly at the end of the disease where you have very critical conditions. And it is easily identified by a simple X-ray. You can see opacities in the lungs and also the presence of nodularities, particularly in the upper part of the lungs in the case of humans. Some risk factors are sandblasting, civil construction, I'm trying to put the pointer, mining, and more recently, I'm trying to put I think I lost it. Doesn't matter. I think it's better if I go without the. Okay, I'll try. Otherwise, okay. I'm really sorry. So
Medium for that. That's Miriam's point.
Very useful. So, and And more recently, these fashion victims, with because of these stonewashed genes, you have an increase in the number of deaths, particularly with the young people who deal with such activity. So very briefly, to give you an idea how silicosis developed, we know that we have the particles going inside the airways. And while in this way inside the body, they will activate some cells, such as epithelial cells, which line the airways, and also macrophages, alveolar macrophages. And together, once activated, they will release a wide range of mediators, including cytokines and chemokines, that will activate and induce the recruitment of other cell types, such as neutrophils, lymphocytes, and more macrophages, and also metalloproteases, that together they will induce tissue lesion, also affecting endothelial cells, increase of vascular permeability increase, or also vasodilatation, and also affecting pneumocytes type 1 and type 2. So have this inflammatory response established here, and the body will try to repair this. And to do that, another range of mediators will be released, such as the fibrogenic and chemotatic cytokines, that will induce more recruitment of fibrocytes, activation of fibroblasts, that once the activation condition, they will release more of the extracellular matrix, they will proliferate more. So, and this will end up with fibrosis. So this is a complex scenario. And if we think about treatment, this becomes even worse, because there is no treatment for fibrotic diseases, including silicosis. What is being done is some procedures, such as the lung wash, in which you do a bronchoalveolar lavage, trying to get rid of the particles, and some supportive therapy, including bronchodilators and suppressive cough, and also oxygen therapy. And there is a last one, which is more complicated, which is the lung transplantation. Most of the times, the patients can't they will die before the procedure, and you have a lot of problems concerning rejection and so on. It's very complicated. So it's quite clear to see that the need to find effective antifibrotic therapies. And because of that, nanotechnology appeared. And this deals with manipulating matter in a very small sizes. I mean, from 1 to 100 nanometers, and looks quite promising. And because you can use in different areas of the research, and particularly in the case of the medicine, they are being used for diagnostic and treatment. Some advantages are high stability, high carrier capacity, controlled drug release, and feasibility of variable routes of administration. And concerning biomedical activities, some types of nanoparticles are being used, such as polymers, liposomes, nanotubes, and also gold nanoparticles. It's where I want to focus with you today. We know that the gold as medicine has been used for many, many years, dating from the Middle Ages, and because of their anti-inflammatory and antioxidant activity. It was, in fact, the gold salt at that time. And it was used in the case of arthritis, some chronic diseases, but because of some side effects, it was stopped. But the gold nanoparticles appeared, let's say, for the last 10 years. And some important, and this brought a lot of promising thoughts about using in the medicine. And some aspects are very important to consider related to the gold nanoparticles, which is the shape. We have different, most of the time they're using the sphere, but we have different types of shape, the size. This is quite important concerning toxicity, because very, very small particles are more toxic than the bigger ones. Also have the surface coating, which is a property, because the surface is the way the particle can interact with the medium. So alterations can be made, you can absorb some substances that will favor their use. And also the functionalization, which you can use receptors. You can bind antibodies, peptides, and all of this will help let's say, will amplify the use in biomedical activities. So bringing the gold nanoparticles to lungs and to inflammation, we previously demonstrated that the treatment with gold nanoparticles by aerosol, the topical administration, was effective in inhibiting the allergic asthma, the more acute model of allergic asthma. So here, it's a bit small, the picture, but it's the eosinophil infiltration, which is an important marker of asthma, was suppressed by gold nanoparticles together with extracellular matrix deposition. And also the hyperactivity, airway hyperactivity was sensitive to gold nanoparticles given by aerosol. So with this data, we move to another model, which is interesting, which is a glucocorticoid resistant model of asthma. It was in the AJ mice. So when we treated this is a model with 9 weeks, so it's a longer protocol, and the animals received the gold nanoparticles, but the same way 1 hour before the antigen. So here we look on the cellularity. So in the bronchoalveolar lavage, as well in the tissue, we can see here this pink column is the steroid, showing that it's resistant to steroid treatment, but was sensitive to treatment with the gold nanoparticles. Particularly in this case, when you have this refractory asthma, we change a little bit the profile of the cells. So instead of having more eosinophils, we have also neutrophils. And you know that the neutrophils are more refractory to glucocorticoid effect. So in this case, we showed here the inhibition in the bowel, the bronchoalveolar lavage, and also in the tissue, the neutrophil, and also the suppression of the peri is the position of the extracellular matrix. We also looked at a very interesting effect of these gold nanoparticles, is the antioxidative effect. So here you have the malondialdehyde and also the enzyme, which is a catalase to have reduction under conditions of this system, and they both were sensitive to treatment with gold nanoparticles. And also in the case of HDAC, which is quite important in this model of refractiveness to the steroid, that was reduced in the case of the asthmatic animals and was restored in such condition. So I have just forgotten to mention that we have looked on this NRF2, which is a transcription factor associated with antioxidative enzymes, and it was increased. So with this in mind, we showed that the gold nanoparticles were being quite effective in, let's say, inhibiting the response in the allergic model of refractory to corticoids. So this seemed to us quite promising. So we decided to move to our system with the silicosis. And in this particular model, we induce silicosis by a non-invasive, by injecting intranasally the silica. And here is just to show you an idea about the progression of the disease. So it's 12 hours, 2 days, and we can see that the response is getting more and more complex. And we do have already fibrosis at 7 days, but it's at 28 days that we can see a more classical response of a mature granuloma. They are coalescent here, one close to the others, at 28 days. This is to show you just the morphometry. We analyze how we analyze, we quantify this fibrotic response, because we can't just count granulomas. We have to analyze the area of the lungs that are occupied by granulomas. And here is just to show you it's some scanned photomicrographs showing how the response is in these animals. Here's the methoxylineosine and the Picrocereus, the stain. Você vai tirar ele, né? I'm going to remove. I should put this photo at the bottom, not on the top. Okay, great, thank you. So just for you to see how the lungs are from silicotic, and here we use the microcidius, which stands for collagen, showing that we have a co-localization with the granuloma formation and the fibrotic response. So I'll just back. I focus on this time, 28 days, to do the analysis of the treatment with the gold nanoparticles, and the protocol we use is we try a therapeutic approach. So trying to get close to the clinics in which you have the patient with the process already established and you have to treat them. So what we do is we start treating the animals 21 days after silica installation, a time that we are sure that the response is already there. And we treat them every 2 days, and we did the analysis 1 day after the last administration. So the first parameter that we analyzed was the lung function, and we use this is a biosystem platform we have there, is the invasive plethysmography, the whole body invasive plethysmography, which give us two important parameters, resistance and elastance. So resistance is more a measure of airway function, more the flux of the air, and the elastance is more in the periphery, more related to the parenchyma. So what we could see here is that we have the animals, the silicotic animals, showing response, an increased response when aerosolized methacholine, which is a bronchoconstriction agent, and try to reveal a hyperreactivity response, which is a phenomenon associated normally with most of the lung diseases, chronic lung disease. So we have here an increase also in the basal of the elastance, showing that the lungs of these animals show they are more compromised with the inflammatory and the fibrotic response. So once we aerosolize methacholine, this response increases, is exacerbated, showing hyperreactivity. And when we treated with gold nanoparticles, we tried 3 concentrations, we could see inhibition, particularly in the case of the elastance. So going towards the tissue, here we can see the lungs from the control animals, quite well preserved, no indication of cellular infiltration. But when we move to the animals, the silicotic animals, we can see the presence of a well-established granuloma, is a mature granuloma, in which we can find, let's say, a large part of the lungs occupied by granulomas. And they have a well-defined structure in which we can see a more central necrotic zone. Then we have the neutrophils on the periphery, and externally we have this edge matrix thickening, more fibroblasts staying here, and this gives the shape of the granuloma. And when we treated the animals with the gold nanoparticles, what we saw was a time-dependent alteration in these granulomas, and it was like they were disorganized. So we can't find anymore the specific zones of the granuloma. We lost this necrotic zone, you see, and also we can see more open airway spaces, indicating perhaps area of reventilation. When we did the analysis of the morphometry with the granuloma, we couldn't see significant difference, although we have qualitatively, we couldn't find this quantitatively because the response was there in a completely different way. Looking on the fibrosis, as I mentioned, we use the microcidius, which stands for collagen fibers. And we can see here the controls, and here the presence of the collagen fibers deposition in this granuloma. And when we treated, we also saw a complete disorganization of these granulomas. Here. And then when we quantified the collagen amount in the lungs, we could see an increase in the silicotic compared to the controls, but nothing happened in the case of treatment with gold nanoparticles. Okay. And as we saw those more open spaces, we thought of looking better on the airways. And we can see that compared to the well-preserved areas in the controls, the airways in the silicotic animals, they showed a smaller diameter. And the lumen shows a smaller diameter. Sometimes they are closed. And this might be associated with the mechanical pressure of the presence of the granuloma inside the tissue. When we treated with the gold nanoparticles, we saw more or less the same disorganization of the granulomas, but interestingly, we saw more open airways here, and they, curiously, they were filled by a cell plug. The magnification doesn't let us to see inside, but in fact, it seems that this may be considered a way of a clearance of the cells containing particles outside the airways. Because we have an improvement, you can see more open spaces, and these are plugs showing that the cells might be going out of the airways. Concerning the cells, we can see that we have in the granuloma a lot of mononuclear cells. The morphology tells us that they look like more macrophages. And when we look on the treated animals, we can see that we have these cells coming out of the tissue. They are bigger, they look more activated, and they are more in the periphery of the granuloma, suggesting to us that these cells are more coming from out of the granuloma, exiting the granuloma, rather than arriving at that time at the response. The last characterization of these cells, in order to check about mononuclear cells and PMN, we use these esterase with labels for granulocytes. And we can see here in the cell line some pinkish cells. Is more difficult because of the size of the photomicrograph. But here we can see in the granuloma exactly on where they were expected to be in the neutrophilic zone, and they were dispersed in the case of the lung of silicotic animals treated with the gold nanoparticles. So exactly that the granuloma was being dispersed. We use this histochemistry with this acidic phosphatase, which labels for mononuclear cells. You can see some of them here, more round cells, and they reduced in the case of silicotic, but they reappeared in the case of the treatment and showing more elongated shape. Still trying to understand how the gold nanoparticles were affecting this fibrosis in silicosis model, we analyzed some mediators production and focus on cytokines and chemokines first. So have IL-1 beta and TNF, MIP-1 alpha, MCP-1 more mononuclear cells, the chemokines, and MIP-2 more related to neutrophils. All the factors were increased in the black columns under condition of silicosis, and they were sensitive to the treatment with certain variability, but they were sensitive to the treatment with gold nanoparticles except the MCP-1. And then we wondered, we asked ourselves about the time of the treatment, for how long this effect can last. And to do that, we use the same system, but we treated the animals every 2 days, but instead of looking on 28 days, we stopped the treatment and then waited for 15 days, and we'll look on 45 days after that. So in the case of the lung function, we can see that the resistance and the hyperactivity is there, and the gold nanoparticles are still affecting, reducing this hyperactivity response. When we look on the tissue, we could see that, looking on the hematoxylin eosin, that at this time, we did show a reduction in the number of the percentage of granuloma, I mean, and as well as what happened in the case of the collagen. So This told to us, I think there is also the cytokines, they were still sensitive, and the MCP1 is a profibrotic chemokine at this time was inhibited by the gold nanoparticles. So this told us that the effect of the gold nanoparticles are not only related to the dose, but also depends on the time of effect of the treatment. So what about my time? Meu tempo? Okay. So we'll try to go a bit deeper, and we use this electron microscopy. And this time we looked at the lungs in 3 different compartments: external, center, and internal. And these left panel images here, we can see that the epithelial cells are preserved in the internal part. Also in the center here, you can see the preserved endothelial cells. And we have the presence of fibroblasts and collagen under normal conditions in the external part. When we look on the silica, the tissue was destroyed. It's more or less what we saw in the case of when you look on the light microscopy. So here we can see the epithelial cells completely damaged. Here the fibroblasts, they look completely different, they look more activated. And there was a thick deposition of collagen, particularly in the external part of the lungs. And after treatment with the gold nanoparticles, we saw that something improved, because we can see more alveolar spaces opened, the epithelial cells recovered partially their normal condition. And interestingly, we saw some dark osmophilic dark particles inside the macrophages, showing that these are the gold nanoparticles. So they were really reaching the lungs. Okay, so that's quite important to us. And in the external part, again, we have reduction in this thick collagen deposition, and the fibroblasts look better. 28, yeah. We just did one look at the time. And so looking on the severity of the lesions, we ranked from 0 to 4, and we look on architecture integrity and the collagen fibers deposition. We can see here that under conditions of silicosis, we have reduction in the integrity, these dark, black columns, and increasing collagen deposition. And after treatment, we saw reduction in this, let's say, the integrity of the, sorry. Yes, got it. So we saw improving the integrity of the tissue, and also reduction in the collagen deposition, particularly more in the external part of the lungs. So once we detected the particles in the lungs, we thought about the distribution of these particles. And to do that, we we irradiated the gold nanoparticles. So they are now the isotope 198. And then what we did was inject intravenously to see where the particles were going to. And so we inject intravenously, and then we looked at 2, 4, and 6 hours after the particles injection intravenously. So what we can see here is the majority of the particles accumulated in the liver and spleen, as was expected. But in the case of 4 hours, we saw a little bit of increase in the kidneys. And so we thought about, what about the pharmacokinetics of these particles? So what we did is exactly reproduce the same protocol of gold particles administration here. And we used different groups, the normal and silicotic animals, just to compare if the silicosis could interfere and somehow the distribution of these gold nanoparticles. So what we can see here is that the gold nanoparticles appeared in different compartments of the body. Okay, so it's well distributed in this condition. But what about the effect of this in other parameters? So what we look on cellular and biochemical parameters with the blood, peripheral blood. But first we look on body weight, water intake, and food intake, and nothing was modified. So here's just to check, we have the saline minus and plus gold nanoparticles and silica minus and plus the particles. We look on cellularity in the peripheral blood. So cells like erythrocytes, leukocytes, platelets were not modified under both conditions, neither in the saline, neither in silicotic animals. But we tried some biochemical parameters, and we analyzed the aspartate and alanine aminotransferase were markers of liver toxicity. And so we couldn't see much difference here. We also look at plasma creatinine, which is indicator of the kidney function. Nothing happened, and the urea as well. So, but then we moved further as we saw at 4 hours, some particles in the kidneys. We analyzed more the kidney function. And to do that, we looked on the urinary flow. It was not altered in any conditions. The urinary creatinine, which matches well with the no alterations in the blood, and also other parameters, including this GRF, which is, I think, is a glomerular. This is my dear friend who did. This is the glomerular flow, and then the other is the tubular. So we couldn't see much difference here. And so looking on the histology was our last approach. We can see that nothing happened at such conditions with the gold nanoparticles in the liver, neither in the kidneys. And just a couple of slides, because I mentioned before that we do have different types of fibrotic diseases. Yeah? And in this case is the IPF. So we saw that it worked on the case of the granuloma, but we asked whether this effect, the antifibrotic effect of the gold nanoparticles, could be extended to other responses very, very, very quickly. So this is the idiopathic pulmonary fibrosis, which is also a serious disease. It is affects worldwide, but in this particular case, there are 2 medicines like nintedanib and pirfenidone that were approved by FDA. But they are for mild cases of the fibrosis, and they have some side effects, patient withdrawal, high cost, and but they increase lifespan. But this means that we still need to search for new therapies. So we use the bleomycin system in the black 6 mice. So look on the function, we can see here we just tried 2 concentrations that this hyperactivity response was sensitive to the treatment of with the gold nanoparticles. In this case, the response is completely different. We have some patches. The fibrotic response is dispersed on the parenchyma, so we are not able to do morphometry. We have to do score, and so this is what we did. Here we have the bleomycin stimulated animals and treated, and here with the mast cell, you can see the blue part is the extracellular matrix deposition. So after the treatment with the gold nanoparticles, we had inhibition. Collagen deposition was also inhibited in this condition of treatment with the gold nanoparticles. And here we analyzed the both subtypes, type 1 and type 3, both increase type 1 more because in fact you have the response starts with type 3 that changes to type 1. And we could see that the type 1 was also, the collagen deposition was inhibited by gold nanoparticles. Reinforcing the antioxidant activity of the gold nanoparticles, we saw inhibition of ROS, the T-bars, which is tissue, the oxidative damage, and also the reduction that we saw in some antioxidative enzymes such as catalase and SOD. The catalase was sensitive. We know that the SOD is not so sensitive to gold nanoparticles. And at last, the transcription factor, NFR2, that was increased. It was already increased, a little bit increased in the case of the bleomycin animals, showing that perhaps a response, a natural response, but was exacerbated under the case of gold nanoparticles. So in conclusion, Our findings show that aerosolization with gold nanoparticles improve lung function and reduce fibrogranulomatosis response to silica particles. At such conditions, we couldn't find measurable liver and renal toxicity, indicating that perhaps they could be a quite promising therapy to be used in the case of some fibrotic responses. Just one thing I have to mention is this project is part of a network of Rede Nanosaúde that was supported by FAPERJ. This is a big project, including 25 laboratories, in which you have Marco Aurelio as coordinator, Patrícia IOC as vice coordinator. Again, the two institutes together in the project. So here is just people involved in the study. Just Natalia did the work on silicosis and Gabriela on bleomycin. Here is the past and the present. Our collaborators, Marcelo Pelágio, Vera Capelloz with the electron microscopy, Ralph Oliveira helping us with the irradiation of the particles, and my dear friend Celso Caruso helped us with the kidney stuff. So our supportive, and thanks very much. Okay.
Well, we are going to open questions as it's usually done. We first open for the students. I don't know if there are any questions from the students in São Paulo.
Hi, Bruno. Not yet. They're warming up.
Just a second.
But I can start with a few little questions, if you guys don't mind, or if you don't have any.
Oh, please go ahead.
Hi, Patrícia. Super thanks. Very, very beautiful work. I have a couple of, I think it's more technical questions. You first showed your nanoparticles could be coupled to, you know, a few things, but I did not quite understand if in your case, it's just like a free gold nanoparticles, or this is coupled to something. I'm sorry, I think I missed that. And then I'll follow the question after you.
Right.
Thank you.
Hi, Gustavo, thanks. You are talking about the gold nanoparticles, you mean? The way we use?
Yes. Is it coupled to something? How
No,
they...
Yeah, they are, let's say, the nude gold nanoparticles. We bought these particles from the Sigma. They are prepared, and then they are nude. They are not binding to anything, just gold nanoparticles.
Right. So how they modulate the inflammation? Is there any in vitro data on the activation of macrophages? Because in the beginning, I thought you were coupling with some immunomodulators, but then yeah, I realized that these are nude. It's just bare, you know, gold nanoparticles. How they modulate? Is there anything known about that?
Yeah, this is a very this is the point we have been pursuing. In fact, we did some experiments in vitro while we are able to do these experiments. They were not so good in inhibiting, let's say, fibroblasts, you know, the primary culture of fibroblasts, but they had some effect on the macrophages. We used the lineage, which is noveolar macrophage from mice with AMJ. I can't remember the number now, but they had some effect, but we do still have to repeat this. What we think may be doing, Gustavo, in vivo, is trying to, this is what we are trying to pursue, is I think that something will be happening with the macrophages, you know. I don't know if there is a more, let's say, a stimulation, activation of some proteases, because it's quite hard to understand how you have this collagen being digested, you know. And so I think it might be a protease. We thought about metalloproteases, some of them can do that. We have to do zymography and other approaches to check this. But what we think is that macrophages seem to be, and it's interesting because it was not so clear in the photomicrographs I showed here because of the definition. But they look quite different, you know. The point is because we're just looking at morphology. So we have already started some experiments using flow cytometry to see if we can identify differences in these macrophage population. This is what I can tell.
I'm just curious because the two particles are inert, as far as I understand, both the silica particle and the gold, but they cause completely different results in vivo. I'm not sure if you know how much has been done in vitro. So are the difference in size, like I imagine that the silica particles are much bigger than the gold nanoparticles? That could be
the gold nanoparticles are 10 sorry.
No, I was just wondering if that could be some of, you know, explain some of the mechanism by interacting with the small or large inert particles. The macrophage could respond in a different way. Let's see, the one is more digestible than the others, which I'm not too sure if this is the
reason. So you are proposing a different profile of macrophages, you mean?
I'm just like to understand how two inert particles causes a tremendously different response in a macrophage, for instance. One is pro-inflammatory. So the silica, as I understood, is very pro-inflammatory, you know, and then the gold is, as you know, I think your results are clear. It's less or even anti-inflammatory.
Right, but the silica is not inert, right? It's
no.
It can actually
the macrophages will interact with the silica particles in order to get rid of them, you know, but after that they become activated, and that's why you have that mess of the inflammatory response. Something may be happening inside the cell because you have this increase in this NRF2 transcription factor, and this happened not only in the silica system, but and the paper I showed about the glucocorticoid refractory asthma, you know, we also had several intracellular effects, and in that case you don't have the particles. So we don't know exactly, as I'm telling you, in that case we saw some of the HDAC increase enzymes, which was let's say a mark of this glucocorticoid refractoriness, but we are still trying to understand what's going on. We can detect some markers, you know, but not exactly how things are happening. And seems to be a more, I don't know if I can say it's a more general mechanism, but the profile of anti-inflammatory and antioxidant seems to be there.
No, I'm just staying here because the camera seems to like me more than you. I moved there, the camera followed me. So that's why I'm staying next to you.
What can I do?
All right. No, but just a follow-up on the Gustavo question and trying to understand a little bit how these things go. The silica particle actually can generate reactive oxygen species, right? By itself. Its surface is reactive in some sort of way that can produce damage by itself, right? It's not just as a secondary consequence of from the ingestion by macrophages, activation, and then the macrophages actually doing the damage, right?
The point is how you superimpose this effect
Yeah.
with the gold nanoparticles.
Yeah, no, that's
I know. This is really very complex, Gustavo, and we have been trying to find, let's say, hypotheses to justify that. So we are not trying to get data, and I don't have this answer to you. But the point is, because, for instance, more the acute phase, I think you have a more pronounced effect, as you're mentioning, of the silica particles activating the macrophages. But we started treating 21 days after, although we still have silica particles present in the lungs, because you have some residual effect. Perhaps at this time, we might be, let's say, with the predominant effect of the gold nanoparticles instead of the silica, you know? I don't know if it makes sense, but we still have some particles, but the effect that the one you mentioned about activation of macrophages are not so intense, you know?
right. And I think there is another question is, are the silica particles removed from the lung, you know, during the normal course of the disease? Is these 28 days disease is still being fueled by the silica particles? And what happened to these silica particles after you administer the gold particles?
Yeah, this is another point. And in fact, I didn't show the data because of the time. And we know that the silica particles, they, in a normal condition, they goes to the mediastinal lymph node, you know. So you can see some, even fibrosis, you know, have an inflammatory response in the lymph nodes. And they can go up to, let's say, further, you know, in the lymphatic system. When you have such drugs or treatments that improve the silicotic response, we do have more particles appear in the lymph nodes. This happened with the gold nanoparticles, you know, and we don't know because lymphatic is another point of complexity, you know, but we do have the silica particles going towards the lymph node under normal conditions, let's say normal silicosis. And when we treat and we improve the response, you have reduction in let's say, reduction in the particles inside the lungs, because using these precursors and you go to polarized microscopy, it's easy because the silica particles, they are bright blue. So we can count as pixel, you know. We do have this data, and there was a reduction in the silica particles inside the lungs. But yeah.
We do have a question from a student here in Rio, and then we are going to pass to Diego, I believe, for his question, and then we'll have then a further one from here from Cristiane. So Lucas, please.
Hi, thank you for your this is very interesting. A bit of what I was going to ask, Bruno already asked, it was already asked before, but I was also wondering whether, do you think that maybe there's also a mechanical effect of the gold nanoparticles, so some like of a pressure that over the granulomas that would maybe help like expelling some cells, and then maybe this would help shape the response? Or if maybe, do you think that the gold nanoparticles are interacting with any specific like protein metal complex that usually happens? Because you know that there is like copper mediated cell death and iron mediated cell death. So whether maybe the gold nanoparticles would be interacting with some of those metalloprotein complexes that would maybe help shape the response.
Thank you. It's a very complex question, difficult to answer. Anyway, at least with the tools we have in hands now. Yes, if there is any interference with this metal, as you mentioned, I don't know. What we think is perhaps what's happening is, again, it's just hypothesis, you know. We need to get some data proper so that we can do like constructing a better hypothesis. And so it seems to me that based on the morphology, that by a way that I don't know exactly how, these gold nanoparticles are modulating these cells. Even because Bruno mentioned about the phagocytosis, I don't know. I think that if you can, let's say, identify these macrophages, perhaps some of them may be not so able to phagocytize particles, you know, because you mentioned about the interaction with the silica particles. I don't know if it's another subtype that is more pro-resolutive, you know, and not so like M2, for instance, or not so M1. You know, this is something that we have been trying to check. Now, I don't know if there is any type of interaction. What we think is about modulating metalloproteases, but perhaps this might be genomic. You know, I don't know. And something that is interesting is because when you look on the tissue, you can see that this effect seems to be more on the periphery of the granuloma. So once you break that thickening, you know, it's there that you have the collagen, you know, the collagen fibers that they do this, they surround the granuloma. It's from there that the cells are coming out. You know, it's more or less like they're losing the, how can I say, membrane? It's not the membrane of the granuloma, but let's say the edge. Yeah, the caps of the granuloma, you know, might be something like that. No, it's a bit intriguing, yes, because and even as I mentioned before, because you are having this anti-inflammatory response and this anti-fibrotic response in two completely different responses. But I mean, in asthma, you don't have particles, and then you have the silica, and they show more or less the same mechanism. I don't know if there will be just one mechanism, and by this way it will be active, because you can also see the degradation of the collagen fibers, the extracellular matrix in asthma. You have reduction in the remodeling, which remodeling this system is really peribronchial, but it's very intense. And it's also, let's say, the collagen is broken by the particles.
Okay, thank you. Diego, please.
Can you hear me, guys?
Sure.
Yep. Yeah, just a quick question. I was curious if you have any clue if this treatment with the gold nanoparticles also induce this anti-inflammatory, or maybe better, the antioxidant response in the tissue cells, not just in macrophages. For example, the NRF2 expression. Do you have any clue if the gold nanoparticle treatment can also induce this antioxidant response in the parenchymal cells, in the tissue cells?
The analysis we did, Diego, was just in the whole lung tissue. We haven't looked, right, let's say, more or less in isolated cells. I don't know if that's the point you asked me. No.
Yeah, no, but also if you have any clue, you know, if there is any data in the literature saying that this kind of treatment can also trigger these mechanisms, not just in immune cells, but also in other cells.
No, we haven't tried that. No. This is a very good point, because this is a very important property of the antioxidant activity of these gold nanoparticles. So it's interesting point.
Okay, thank you.
Okay, thank you. We have a question from Cristiane now.
Hi, Patrícia. Thank you very much. It was beautiful as always. And I love that picture. You need to give me that picture that I'm with Marco. But I was curious about your model. I don't know much about your model. Do you have any evaluation of mortality? I mean, animals, they can die using your kind of silicosis model?
Chris, in fact, no. We do have, the mortality is very, very small, you know, and particularly we have some problems because the silica particles can aggregate. So when they aggregate and you have to sonicate and so on, but because silica is hydrophobic, so it attracts water. So sometimes you have big aggregates, and in such cases, if you inject the silica, the animals die in 4 or 5 because of obstruction of the airways. But normally doing with this concentration, you use 10 milligrams intranasally, And we also tried the aspiration, the oropharyngeal aspiration, and they don't die. This is one of the points that we know that the experiment can, let's say, be followed or not, because if this happens at 4 or 5 days, and you have some, because of the aggregation, the big particles, let's say, inside the areas.
But do you have followed the animals for more than 45 days? I mean, the lung is so completely compromised.
Yeah, this is a very good point. But no, we looked at 2 months, and then I think that the animals, the rodents, perhaps they find a different, let's say, way of survival, because it's amazing. Sometimes when you look at the lungs, you wonder how the animal could, stay alive with such compromise. With the such compromise of the tissue.
Okay. And my other small question is about glucocorticoids. Do you think nanoparticles, gold nanoparticles, can change corticoid levels, and there is no role for corticoid treatment in silicosis?
Yeah, I don't know about the treatment with gold nanoparticles. They modulate glucocorticoid levels. I don't know that. But the point is, because the silicosis is refractory to glucocorticoid, it is. Even in the clinics, so even with the more, let's say, the modern, the most updated steroids, they are not quite effective. And I think it's particularly because we have this neutrophil infiltration, which is the majority of the cells there.
And last small thing, for humans with silicosis, of course, it's not sterile. I mean, it's not sterile. They have other things going on in life. In the model, of course, you can manipulate that. Do you think the interactions with, infections, fungus and other things like that, of silicosis, it is going to make silicosis worse?
Yeah, this is one point, at least consider the experimental model. What we do is we work the silica opening under sterile conditions. Here we have already irradiated ones, plus and minus, because we buy from Sigma, and then we couldn't see much difference. Concerning humans, of course, once we stimulate the particles, we have no control. And in humans, the silicotic patients, they are more immunosuppressed. So it's quite common for you to have, let's say, TB in these patients. It's the only way you can find eosinophils in the lungs of these patients. So they are immunosuppressed. So they can get more easily infections. This is true.
Hey, Gustavo, I don't know if you guys have another question on your side.
Just a quick one following Cristiane's. What about granuloma from bacteria? Because apparently your nanoparticles is dismantling the granuloma from silica. But what happens if it's dismantled the granuloma from a mycobacterium, for instance? Would it be good? Or would it be bad, or from Leishmania?
Hi, Gustavo. Yeah, we have never tried that. And what I know is that the gold nanoparticles are effective against granuloma from Schistosoma mansoni in liver. This is in the literature, but not. I don't have an answer concerning bacteria. I have never, let's say, came across a work, let's say, dealing with such system.
I have one last question here. That's if I understood, and maybe I was wrong. I'm often, I am wrong, but you showed that neutrophils are part of the granuloma. They are like in that intermediate section just below the capsule. And you have these big number of neutrophils there. The first thing is how the neutrophils can survive inside of a granuloma, if they are surviving there, or if you just have a high turnover that can keep these large amount of cells there. And once you give the gold particles, it seems that the population changes. And but you did not follow what happened with these neutrophils. Are these neutrophils dying and you know, just melting away? They are being eaten by the macrophages. That's why you have such big macrophages. What's going on with these neutrophils in your model?
Very good point. We have tried pursuing the neutrophils for some time, but it's not so easy to deal with them. We tried using, let's say, depleting the cells with serum, but they not work properly. One point is we do have differently from some responses. You don't have waves. For instance, the neutrophils, they started appearing increased, let's say, 1 day after silica installation, and they can stay up to 20 days because of this residual effect of silica. We have another look with this, let's say, by this way on the neutrophils, but we do think that they may be implicated. I'll tell you why. Because these are very new data that we have looked on net on the neutrophils. Because we know that silica can induce net formation, not only neutrophils from mice, but also from humans. And we try to use the pulmozyme, which is a DNase that interferes with the net. And then when you treat the animals with this compound, you can have inhibition of the fibrosis. So we treat the animal in very acute phase, look at 7 days, in the acute phase of silicosis, we have reduction in the inflammatory response there, indicate that the neutrophils are there, are playing a role. And then we also did the same thing. We treat and then we stop and we look at 28 days and we have reduction of the response. So I think that this net might be, let's say, contributing, and by this way, the neutrophils contributing to silicosis and to fibrosis. This is a very, let's say, I won't say preliminary data we are doing together with Fernando Cunha from Ribeirão Preto. And they will also use the pad for knockout mice, but I'm not that convinced that is via pad. But I think the neutrophils do have a role. But concerning the granuloma, as you asked me, I just turned down the question because I don't know. No, in fact, we haven't looked on the because of the difficulty of looking on the neutrophils. I think that after that we are more, let's say, more convinced that the neutrophils do a role. I don't know. We can see a lot of cells. I agree with you. Those big mononuclear cells that have a coli inside, they are a lot activated, and sometimes you can see cells inside the phagocytized cells. So might be something like that. This is only what I can tell you.
All right, Patrícia, thank you very much. Thank you very much for everybody there in São Paulo. Gustavo, thank you. I have to look at you, but to look at the camera, so you can look at me. It was very nice seeing you guys. Have a nice week. Patrícia, thank you very much for your talk. It was really a pleasure. It was very interesting. Lots to think about in this model. And I'll see you guys next week. Patrícia has one last word.
No, just to say bye-bye, Gustavo, was nice. And thanks for the challenging questions. Of course, they will be quite helpful to help us to understand what's going on with the gold nanoparticle. Thanks a lot.
Thank you.
Thank you, everybody. Bye-bye. See you next week.